ACOX1 genetic deficiency is a gain-of-function disorder that was defined by Botticelli and colleagues. It was gain-of-function, and since it's a gain-of-function, our goal is to lower the levels of ACOX1 as a therapy for Mitchell syndrome. So the way to do that is using an antisense oligonucleotide that will lower the RNA and then lower the protein, and that's what we're trying to do. Zeta's identified cells that express ACOX1, so that's the first step. We got to find some way that is there a cell in the dish that expresses the gene of interest, ACOX1. Next step is to develop antisense oligonucleotides, and Kathleen and Zeta have done that and identified them. And the preliminary look is it looks pretty good. We've identified some sequences. We've identified multiple genes. Multiple antisense oligonucleotides. We've identified several that look like they lower levels of ACOX1 in the very easy to use cells that we started with. So that's the first step. It's actually looks really good. It's the first step.
This is what's called preclinical work, right?
Preclinical, yeah, you wouldn't use these in clinic.
Right.
So then the next step is to move to cells that we think are more important or more closely related to the disease. So we're working on that. That's a tricky step because the cells that we want to use, we're trying to figure out exactly which cells and how to model those in a dish. So that's a step that we're working on. And then the next step is just keep moving on down the line to come up with a better and better, more potent ASO. Think about toxicities. Think about safety. How do we translate it? So it's all started. I think it looks good. Yeah.
Can you introduce yourself for our viewers at home?
All right, there you go. Hi, I'm Tim Miller, neurologist, neuroscientist at Washington University in St. Louis.
Wearing a new coat.
Thank you for noticing.
Exactly.
Thank you.